is Jill Bray-Bowen, CEO of Northwestern Medical Center and your host of the NMC Health Beat Show, dedicated to discussing important healthcare topics of interest to our community. Today, I'll be talking with Dr. Elisabeth Fontaine, who is the medical director of both Rise Vermont and NMC's Lifestyle Medicine Program, and health coach John Burke. So they're going to talk about health coaching and describe to us what that is and what's happening in that field. So welcome. So thanks for joining the show today. I look forward to this discussion myself. So if we could just start off maybe by just introducing yourself and what you do at Northwestern Medical Center, and then we'll dive into our subject.
Well, thank you. We're very happy to be here today. We've been here a few times before, so people know me in this community as the OBGYN because I've been here practicing for 25 years. Basically what I tell my patient when they come in the office is my background when I was studying prior to medical school was exercise physiology and obesity. So when I saw my people kind of changing their health within the last 10 years, I kind of researched in order to try to help them change their lifestyle. And there's an American College of Lifestyle Medicine, so physician and healthcare practitioner in general are deeply interested to make change in lifestyle of their patient to help them to stay healthy. And therefore, I joined the American College. I became board certified in lifestyle medicine, and this is what I do in my practice at Northwestern Medical Center, surrounded by people like John that are health coach, which we will discuss a little later.
Great.
Thank you as well. My name is John Burke. I work as a certified athletic trainer in lifestyle medicine. I've been here just over 10 months. Prior to this, for about 10 years, I was in orthopedic rehab and then contracted to a local high school. And thrilled to be here.
Great. Great background.
Thanks.
Thank you for sharing that. So you mentioned lifestyle medicine. So before we get into health coaching, you know, what is lifestyle medicine? So let's do a little bit of discussion about that and move into health coaching.
That's a good question. And the majority of people kind of question what is it, get confused, especially at the very beginning. Now it seems that it's a little bit more accepted in the environment. So lifestyle is an evidence-based medicine program. So what does evidence-based means? That means that we have many studies that have demonstrated that using simple lifestyle change, you can not only improve your health, but you can reverse some of the chronic disease and improve significantly your health. So, you know, if you are interested to look at this, there's an American College Lifestyle Medicine website where you have all the studies that are available for all the people that could compare some lifestyle changes compared to medicine. So lifestyle change are very simple when you think about it, is what you put in your mouth, as an example, what you eat, the nutrition, smoking, and what you don't do with your feet, movement. Of course, there's many other aspects, the stress, alcohol. So we do discuss all these change in a very progressive manner in order to help people to change and hopefully stop medication or not taking a medication, which makes a substantial impact into the health of individuals and families.
That's a great, thank you for simplifying it and making sense out of that. So that's really good. So health coaching, so how does this fit into the picture of lifestyle medicine? So from our viewers' perspective, what does that look like, health coaching?
So John will have a lot to say about that since he's in doing a lot of health coaching in the practice. But in my model into the office, I tell people that we have a triad. I have me as a physician specialized in lifestyle. I have a dietitian, and an athletic trainer. All of us have been trained in this health coaching model. And health coaching is confusing also. It's like anybody down the street can call themselves health coach. So I tell people this is not to tell you to go running 3 times a week. It's really a behavior change mindset. So people go to an evidence-based model, recognized on the national level, in order to help people to work on what we call specifically your intrinsic motivator. If you come to see me as a specialist in the office, I'm an expert. I tell you what to do. that works for what I need you to do. But when it comes to change behavior, if it doesn't come from yourself, it's not sustainable. So we try to work as much as we can at the beginning on this. So I'm going to let John kind of invest a little bit and tell maybe what he does when he sees people.
Okay. That would be great.
Sure. To me, I think it's all about building relationships and uncovering their motivators, and that's what leads to sustainable change. I think it also gives them a platform to be heard. You know, when was the last time that they were truly and deeply listened to? So what we do is we reflect everything that we're hearing and respond with empathy and compassion. And that starts that whole process. I mean, if we wanted to talk about going through the steps and what it's like when you walk into our clinic, usually starts with Dr. Fontaine, interviewing them and meeting with them for about 10 or 15 minutes, and then one of the health coaches will come in, and we talk with them and really just listen to them. But we're looking for their strengths, their motivators, and eventually we set a 3-month goal and then some weekly goals. But we also try to create a wellness vision right from the start too. And that's something that they look towards the future. And it's all about what health promoting behaviors that they want to do on a regular basis. You know, for an example, that would be, you know, I'm strong both mentally and physically. I'm active in the community. I'm engaged with family and friends. You know, what's important to them? And that's one of the things that we kind of focus on.
Doesn't it give you the feeling you want to be coach?
Well, the fact, I mean, when you started off was like, it's about the relationship, and then really listened. And when was the last time someone really listened so they open up? So you create a really trusting environment and that confidence in this relationship. It's safe.
Absolutely.
To really open up so that you can release that. And you talked about intrinsic, which is that really those internal motivators that you referred to. So that's really powerful. When you said that for opening statement, I'm like, whoa, this is really powerful. And the connection between the triad that you talked about, that wrap around the individual.
So all of us know, you know, I'm a health coach, so all the three of us use the same technique. So when we prepare ourselves, when we see a new person in the office, we make sure we review, you know, their chart, and we talk to each other. So every time the person comes in, even the dietitian has reviewed what, let's say, John had done as coaching the first time. So that not only we do the nutrition or the medical portion, but we reflect and we check what was written as their vision and their goals. So that's very important that we keep and maintain this mindset the whole time we see the individual. So we tell people that you are right in the middle of all this. We surround you with the physician, the athletic trainer, and the coaching to make it a whole.
Yeah. And you're really meeting them where they're at. So it's not, you sort of have a recipe, but you're shaping it and meeting the individual where they're at. So it's their goals?
It is.
Because they don't have to be large goals,
it has to be created from themselves. You know, because that's where change really begins. You know, they have the power within them. And that's probably the best part of coaching is, you know, when they get to that point and say, you know, I can do this. And maybe they were doubting at first, and we just have to kind of help them get there because the power is within themselves.
So do you really feel that health coaching does impact people's health and well-being?
Well, I think that, you know, like you said, this is new. We've been lucky to be able to start a clinic of lifestyle medicine at NMC, and people are starting to recognize. So physicians are referring to our practice to actually observe, is there any changes that will happen with the people that are referring? And we have a lot of self-referral. So we're starting to see people that are coming and see the change. So when you, and often the example I'm going to use, lots of time people will say, because they're interested with weight management, they often will go in, you know, in a crash diet. And I explained that, you know, what we're looking for is a slow progression to a sustainable change that they will be able to continue. So they are successful. They are demonstrating some success in what they have planned for goals. So it is working.
That's terrific. What does it take to become a health coach? Is it you have to go through a lot?
Well, there's a couple of national certifying agencies and boards. We're involved with the Well Coaches program. For myself, that was an 18-week course. I'm still in the middle of it. It's actually kind of going into the next module for myself, but it can take probably, by the time everything's done, close to a year to complete. And, and that's one of the things that we highlight, the fact that it is rooted in science. It is evidence-based. And I know Dr. Fontaine has already spoke about that. And there's a couple of other programs as well.
Actually, there's more than a couple. There's quite a few programs, but Well Coach was in association with the American College of Lifestyle Medicine and the American College of Sports Medicine. And they're actually all over the world. They have over 10,000 coach that were trained by them. And actually, I was reading this morning that they're now in Australia and New Zealand. So they're in, very much involved. So there's other coaching company, and there's now a national board. So the health coaching arena is becoming very important. As a matter of fact, insurance company is starting to get interested to see, are you doing this kind of intervention, and are you certified? So it is very important. It is a long process, and actually it's getting even more complex. So they're really having some high standard, but it's worth it. I will say that as a physician, I wish I had this background when I was a young physician. It's extremely helpful, not only with the patient, but with friends or family. You're kind of changing the way you talk with people in different situations.
So where do folks find you? So you can self-refer, it sounds like, or that you may be working with physicians or other community members, but where would we find you, and if someone wanted to sign up for health coaching after this? Right.
Yeah, so they can communicate with the hospital, with the lifestyle department. And the phone number is 524-1227. They would talk with the person who's responsible of taking the appointment, Chastity Benjamin. So, and our office is located into the medical building, so the central building that was just open
right
recently.
At the front of the hospital.
At the front, right there.
Wellness, right at the front.
Wow, we like that.
That's great. How many health coaches do you have? So is it just you, John, or?
No, we actually have...
You're coaching too as well.
So John did the program of 18 weeks like I did, but there's also a program of 4 days where somebody from Well Coach come in, which we did about 3 years ago. So we have people in the community, but at the hospital, we have about 11 health coach. So not only people that work with me, but we have most of our dietitians have been trained in the model. We have the diabetic educator. We have other athletic trainer that have been trained. We have people in RiseVT that have been trained in this model.
Super. That's super. So do you have any success stories? I know as people watch us, they're saying, I don't have time, or it's too big, I can't, tackle this. But do you have any success stories, or maybe just think about people on journeys that they're having some positive things and they're feeling better about their lives?
I think there's multiple positive one. Actually, it's interesting because a lot of times, sometimes people haven't even lost weight, but they start feeling better and they realize, oh my gosh, I'm different. And I say, okay, let's just keep going. But I could use an example of an individual that needed surgery for a hernia that came referred by the surgeon. For losing weight, and he had borderline blood pressure elevation. And so with the coaching, which was, the perfect individual in itself, because person that is just starting to, get some chronic disease or a little bit overweight, his response was pretty phenomenal, and it's amazing that men respond so well. Women are a little slower, but they are responding very well. But his response in losing weight, blood pressure improved, and as a matter of fact, the weight loss was sufficient that the surgery may not need to happen. So
that's phenomenal.
That is.
That's crazy good. Yeah, that's great. It's because he changed his lifestyle, he didn't need the surgery.
Absolutely.
Talk about reducing cost of healthcare. I mean, really, this is the answer.
Absolutely.
So if you're living a healthier lifestyle, then it's less costly. Chronic
Yes,
disease is so costly, and I know you mentioned you can reverse too, but that's probably a little bit more challenging. Do you have a success moment?
Well, I just really enjoy the smaller successes as well. I know those are great examples, but when I hear back from someone saying that they haven't been this active in 10 years, and that's just beginning a walking program. And hitting that quarter mile, that is success.
Yes.
Or starting to increase fruits and vegetables and seeing the benefits and feeling the benefits, I actually feel pretty good. I have a little bit more energy. Those are the success stories that I love to hear.
That's great. So is there a vision? Our time goes so fast. Love to have you back to talk about it more in the future. Is there a vision here? Where are you going with this? How might folks see this evolve in the future?
Well, when I see people in the office, I say, what I can do in the office is limited really to you. We want to make sure that the community, the impact. So Rise Vermont is important to make the change in the community. But for us would be to have health coach that would be implanted into primary care. Mm-hmm. I think this is where most of the individuals are seen. This action with the primary care to be able to do a warm handoff to somebody who's right there and say, you know what, I feel confident that this individual can support you in your behavior change. That would be amazing. And plus we have also downtown the building.
The Congressman.
Thank you for helping.
Yes.
So this is another area where hopefully we could do some health coaching into the community with the kitchen, where we're going to demonstration kitchen that will allow people to learn and practice, health behavior with nutrition. So once you connect all this together, then this is where you make a community change. So we're going to coach a village to health. That's the vision.
That's a great way to wrap it up. Well, thank you both so much for being here, and thanks for really investing in our community and helping them on their journey to well-being. So thank you so much.
Thank you for inviting us.
Yes. I'm Jill Bray-Bowen, CEO of Northwestern Medical Center, and your host for today. And I'm really hoping that you take away from this and begin really thinking about yourself and the possibilities of taking little steps and working with our health coaches to improve your health. So thank you for joining us today.